I'm Robyn. I work at BC Women's Hospital. I trained at Vancouver General Hospital School of Nursing. In 1989, I graduated. And I've done many different types of nursing over the years. I went into nursing by accident. A friend of my sister's came over one day with her nursing textbooks, and I looked at them and thought that interested me. It was science, sociology, psychology, and people, and I always had a desire to help people. I didn't know what I was getting into at the time, but I'm really happy, and now 32 years later, I still love my career. Most people think of nursing in a pandemic as nurses who work in intensive care and on the COVID units. And I have to say, I really admire the work they're doing. And I'm so proud of our profession and what we've done to step up during a crisis. But there's also a role for those of us who have to keep the regular hospital care going during this pandemic. My role working in a maternal ambulatory clinic was to care for women during high-risk pregnancies. So what we did was continue with their regular care, and a lot of our work involved supporting and reassuring them during a really difficult time. Part of our role during the pandemic has been to provide accurate information for people and to direct people towards evidence-based resources. And I think that's been really crucial, not just with my patients, but with my family and my friends. When I went into nursing, I knew what I was getting into, and I knew there would be risks. I definitely felt an increased sense of fear and anxiety during this pandemic because it wasn't like anything we'd really seen before. My big concerns were whether I would transmit this to my patients or also if I would bring it to my family. And that definitely made me feel uneasy. And of course, I knew there would be transmittable illnesses, and over the years I have dealt with those. I worked in rural Guatemala and dealt with things I'd never experienced before. It wasn't new to me to have a sense of fear and anxiety about the unknown. And so I used my voice to try and increase the protections available to us. So making sure we had adequate PPE and also to advocate for mask wearing for our patients. During the pandemic, I have felt very proud of being a nurse. And when we were banging the pots at 7 p.m., I felt a great sense of pride for what we do as nurses. And even though we weren't able to hug, there was a real sense that we were doing something together that was going to make a difference. I continue to be a nurse because it brings meaning to my life. I also feel like I made a difference, and it's usually the most difficult times where I get the most reward from what I do in my work. I've also had a very diverse career. I've worked in Guatemala, the United States. I worked as an educator. I've worked everywhere from the burn unit to surgery to obstetrics. So it's a very flexible profession. I know that there have been nursing instructors who've brought students to work with me because they said, I heard you still love being a nurse. And after 32 years, I do love it. I still think it's an incredible profession, and I'm really proud of what we do. Governments and employers need to provide adequate resources and staffing so that we can provide the care that we've been trained to give. It's important to recognize the nurses who've been working for many years and to give value to their knowledge and expertise. Providing opportunities for flexible scheduling and job sharing so that people can have a better work-life balance. I'd like for new nurses to know that there are lots of opportunities for advancement and further education, and it would be very important for our government and employers to help financially support nurses to do that. In terms of hiring nurses and bringing people into our profession, I would highlight all the opportunities we have. I've done a few different things. I've worked in other countries. I've worked for an NGO in Guatemala. I also worked in many specialties over the years, and there were endless opportunities for me to do different things within my profession.